I've been playing ice hockey since I was 5 years old, and when I had this devastating injury to my left shoulder, I knew I had to seek the best care out there so I could get back onto the ice and playing hockey again. My name is Jon Kikel. I'm a real estate investor, 50 years old. I live in Edgewater, Miami. I've got a dog named Fozzie. And I played ice hockey all my life. I played since I was a kid and all the way up to college and semi-professionally. It's also been an amazing form of therapy for me, going to the gym, playing sports. I initially injured my shoulder playing ice hockey actually, but then I had a really bad bike accident on an e-bike and fell on it, and that just completely tore it. So that really was devastating because I was in a ton of pain. It was affecting my sleep. I couldn't play hockey. That's when I started seeking some type of solution to try and get it repaired.
So rotator cuff tears account for maybe 30 million visits to physicians each year. And about 40% of those tears, 40%, are massive tears. He was diagnosed with having a massive tear to the rotator cuff. He was given a couple of options in treatment, which didn't fit exactly what his plans were.
The first 3 doctors, and they looked at my MRI, they were very quick to say I needed a full shoulder replacement. And it was such a devastating, information to hear from them that I may not be able to play hockey, possibly ever again.
A contact sport and a total shoulder replacement would be very dangerous, I think, to play with for the risk of fracture around the prosthesis. When we evaluated him, his motion was somewhat limited, but was still pretty good. And there was not much arthritis in the joint itself. The problem was his weakness and pain when lifting his arm above the shoulder level. At Baptist Health Orthopedic Care, the physicians here are fellowship trained in their specialty. So you know you're getting the care of a highly trained specialist in your area of need. Since 2002, I've performed over 100 tuberoplasties. The outcomes for this procedure have been remarkable.
I'd never heard of tuberoplasty ever, and none of the other doctors who looked at my shoulder proposed it either. So when he brought that up, I was very intrigued because he said that it had the potential to get me back on the ice. Maybe not with as much mobility, but probably 90%. This sounded like a perfect solution for me to get out of pain, less recovery time, back to the gym and back playing hockey.
The big tear, the tendon is retracted and there's a big gap. So if you look at it in a model, it'd be something like this with a big exposed area. When people try to lift their arm, it pinches the bone and causes the pain. Tuberoplasty is where we take a portion of the greater tuberosity, this prominence of bone, where the tendons insert, and shave it down so it no longer hits on the acromion. So after surgery, after resecting this bone, even if you lifted the arm, it'll never catch on that part. Because you're doing a resection, there's not a lot of immobilization, and they could start doing things immediately.
My experience at Baptist Health Orthopedic Care was phenomenal. I got back to the gym about 2.5 months later. I was doing physical therapy all before, and then I actually got back on the ice for the first time 3.5 months later.
Mr. Kikel is doing awesome. He's returned to what he wants to do, playing hockey and living a life free of pain. I do encourage him to try to take it a little easy, but this is what his goal was, and this is what he wants to do.
It felt incredible to get back there on the ice, and part of my identity to really go do that consistently. And so it felt amazing to get back out there with the guys and get the exercise and just connect with all my friends, and it was great.